Okay, good morning, everyone. This is another Bumpwise Coffee morning, and today we've got a bit of a sad topic that might be a trigger for some of you. But the reason why we're doing this is really that we're going to talk about loss, about baby loss, infant loss, pregnancy loss, miscarriages, terminations, all of that. And this is a really sad and confronting topic for some. But I feel that as a community, we really have to show up for these parents in a better way. When we hear stories of mamas going through this, it's really intense and they feel utterly neglected and unsupported at the hospital as well as afterwards. So the reason why we are doing this initiative is really to create more awareness around loss. And I've invited today the beautiful Linda, who has a lot of experience working with moms in the perinatal period. She has experience working as a doula. Is specifically trained in grief and loss counseling. And so she will be a really good resource for us this morning. Linda, do you want to do a quick introduction of yourself and then we'll dive into our presentations?
Yeah, thank you, Johanna. It's wonderful to be here again with you to support parents together and the community together. So a little bit about me is I'm originally from the Netherlands, have been in Singapore for over 24 years now. I'm a counselor and I specialize specifically in the pre and postnatal period, as well as fertility counseling, grief counseling, and trauma therapy. Prior to being a counselor, I was a doula in Singapore for 10 years. So I've really made it my career to walk with parents and those that wish to be parents.
Amazing. That's really great to hear. I think I will just use the slides I've prepared as a prompt rather than showing them on screen, so they can see, the viewers can see us later as well. We are recording this and we'll be posting it on YouTube, just so you know. And if there are any mummies and daddies on the call, we're happy to take their questions at any point. So what I really want to say is, as I said earlier, infant loss is a really big thing, and it happens to more people than we would like to believe. And having gone through loss myself, I had an early miscarriage at around 11 weeks for my third pregnancy. And I really thought I was alone. I thought I was the only one who had ever lost a pregnancy. And obviously that's not true, but it was only, months later when I was ready to open up, I guess, that I realized, oh, I have had one and I have gone through this and I know someone, so I think it happens more often than we'd like to think. And the purpose of doing all of this, the talks that we had last year that were instigated by mamas in our group who have gone through loss as well, and some beautiful doulas and osteopaths and so on, and whose names I will share later, because they can be valuable resources for you. I've lost my train of thought, but that doesn't matter. I think it's really important that we support these moms a little bit better. Hi, Chris on the call. Sorry to call you out, but we are really happy to have you here. And okay, so I want to do a quick introduction because I think a lot of us don't know how common it is. So causes for loss can be obviously a mom going through a miscarriage. A lot of those we don't realize. We don't even know that we're pregnant before a loss happens. So that is quite common as well. I think it happens in one of 3 pregnancies, something crazy like that. There's obviously then stillbirth. There are complications that can arise in labor. There can be problems where you detect an abnormality or a life-limiting condition at a scan that you do in pregnancy. And there's obviously stillbirth before or during a birth as well. And these stillbirths are actually quite common. 1.9 million stillbirths occurred worldwide in 2021, sorry. And from the ACOG, the American College of Gynecology, they say that stillbirth is one of the most common adverse pregnancy outcomes, occurring in 1 in 160 deliveries in the United States. So it was an eye-opener for me because I really didn't think it happened that commonly. And so that also means that there are lots of parents out there who need support. And by support, I don't just mean professionals. It's us as a community who really have to reach out to these mamas and tell them that we're there for them in however way they want us to show up for them. So I don't know how to move my slides, but anyway, so miscarriages, they usually happen in the first trimester of pregnancy. And in some cases, they resolve on their own physiologically without us having to go through the other option, which is basically a curettage, where they go into your uterus and remove the pregnancy, basically. And this is quite common. It happens in 10 to 20% of all clinically recognized pregnancies. When we talk about stillbirth, that happens much later. And that is obviously, every loss is valid, and there is no loss that is more grave than others. We all suffer in different ways, but this pregnancy has been a part of you, not just emotionally, but actually physically implanted in your DNA as well. So this is why we want to value all of these losses and terminations as well. But a stillbirth is basically when it happens after 20 weeks, and there the mom has to undergo an induction and actually deliver her baby. And the causes of stillbirth are widely unknown. There are some risk factors, but not everything can be explained, and that can be the hardest thing for some parents to go through. And then there are those pregnancies where we discover abnormalities in the fetus, basically, and this happens in around 6% of pregnancies. These congenital anomalies can be detected during a routine scan, and then the mom or the parents have a decision to make whether they want to terminate the pregnancy because of this medical condition, or whether they want to continue the pregnancy and exercise something we call comfort care, which is basically where we deliver a live baby and then don't do anything to prolong that life, but we maintain body temperature, we bond with the baby, we relieve hunger and thirst, and we allow for bonding and alleviation of discomfort and pain, but we're not aiming to extend that baby's life. If you watched this last year, we had Silvia Fasana on the call, and her baby, who lost her baby Giacomo after just a few hours of birth, but that was a choice that she made, and she has even written a beautiful book about it if you're interested in that. So Silvia was one of the moms who instigated that we should do more for these mummies as well. Okay, and then I just want to quickly, before I move on, hand the baton over to Linda, say how we as doulas support loss, because we are there, we can be there for mothers if they choose to have us in the room with them when they undergo this procedure of induction and birthing their baby. And we can not only give information so that the mom can understand the procedure better and knows what her options are in terms of pain relief, in terms of what she's going to see and experience, because we often feel that the staff at the hospital are not adequately trained to really show up for these mamas. And I know it from busy delivery wards, they're really run off their feet as well. And it's quite difficult for them to be emotionally present for each and one of those clients. And then we also help create memories. And this can be a tough one in the moment, because some mothers, everybody obviously reacts differently. And some mothers are quite keen to participate and to make memories and so on. And others want to take their distance and have difficulty processing it, but then maybe feel that they wish they had done this. So we always encourage them to take photographs. They don't have to look at them until they're ready, but we also do keepsakes like footprints, or taking a lock of the baby and creating a kind of a memory box, and so on. And for many parents, it is beneficial to actually actually hold their baby and be with them and process the moment. And then in the postpartum period, we're there to support in a physical way, because a lot of moms still undergo, the changes that come with having given birth, including the milk coming in, all of the postpartum things like discharge and pelvic floor and so on. So we want to address that and refer to people who are able to support that. So we refer to professionals for physical healing, energetic healing, but also mental health, obviously, as well. And this is where Linda comes in and helps us all the time. And then we can help with subsequent pregnancies as well, when the mom is ready to welcome another baby into their lives. And this, I always need to stress that this is not a replacement, because often we get very insensitive comments from friends and family around us to say, well, at least you can have a baby and just move on to the next one, have another baby, that will solve all your problems. But that's not what we're doing. We're not replacing a baby, not at all. This baby will stay with us forever, and we need to honor and cherish it. But it is quite good to have someone next to you with your subsequent pregnancy, if there is one, for someone to know what you have gone through before and who can support you emotionally and physically in this big event that is happening, because the grief will come up, and it should, and we need to address it as well. And then we have a lot of ways to get support, but I think, Linda, I'd love for you to talk about the emotional aspect first, because I think there's a lot for us to learn. And then at the end, I will give you some resources of body workers, energetic workers, and so on, energy workers rather, who can help you in this difficult phase. Okay, let me see if I can share my screen for Linda now. Just one moment. That's not the one. Okay, I hope this is easy for everyone to see. I couldn't figure out how to do the presentation mode, but that's okay.
That's all right, so we can see this clearly. And thank you for helping me out with the slides. Yeah, I think you can skip through to the third one, because I've already introduced myself.
Okay. Perfect.
Yeah, there we go. So yeah, it's great for me to be able to talk to you today. It's good that we can find some space now in October to address something really important that so many people are going through. So I want to acknowledge the many parents that might be watching this right now who may have gone through a loss themselves, but also the people that might be watching to learn more about supporting a loved one who might be going through this type of loss. Because it's so important that we all create more awareness and more support and more community for something so debilitating yet common. You've already introduced the different types of loss. And I would also like to stress once again that, each of these losses matter, and, there are no, different qualifications of it, because it's also shown in research that, the grief over a pregnancy loss can be every bit as intense as losing a child that has actually already been born. So it's important to really notice how intense that can be. So for those of you that have gone through it, you may recognize some of the things that I've put down there, that, the emotions that you might experience as part of your grief. And it could fluctuate, and also some of the emotions might show up together, can sometimes be quite confusing. So sadness is very common. In the case of pregnancy loss and infant loss, part of grief is that sometimes our brain wants to assign guilt or blame to ourselves as well. So, I see a lot of parents struggling with guilt, shame, self-blame. There might be anger over what happened to them and their baby. That this is just so unfair. Yeah, so to lose a baby at that stage. Isolation, you might feel very lonely. And also some moments you might feel numbness, like having trouble to connect with people around you and your daily life. Sleep disturbances and fatigue can be quite common. You know, your brain is racing, your nervous system has been so assaulted by what you've been through, and fatigue as well, because it's hard work to grieve. Yeah, so changes in appetite, either eating a lot or not having any appetite at all. A particular one about grieving a loss of a baby or a pregnancy is the social isolation. Yeah, as you already mentioned, this is something that a lot of people don't get to talk about a lot, especially if the loss occurred quite early. You know, maybe the parents have not shared the news with many people. And if you're now grieving all by yourself without a community to connect with or people to acknowledge that you have gone through this loss, that is what we call disenfranchised grief, which is something that we all need to support people so that we can overcome that. Yeah, and two parents grieving the same loss together might also look very different for each of them. So what is quite common is that you might notice maybe some strain on the relationship, because not only do you have to go through the roller coaster of your own emotions and grief, but at any given moment to try to understand exactly where is my partner at today, what is going on for them. And you know, it can be very exhausting and difficult trying to figure out how to communicate, how to be there for each other when you're already struggling yourself. Could you go to the next slide, please?
I just wanted to add here that often moms find it quite difficult to see how their partners are going through their.
Yeah.
All they want to do is be that rock for you, that very transactional, very, you know, let's move on, let's do this, let's do that. You know, they're seemingly not grieving when they're not showing it, maybe. And that can be quite hard for the mom as well. And then, yes, our men often brush things under the rug a little bit more easily, maybe not, but
yeah. Those might also be the cultural aspects of grieving, yeah, where it's, you know, women are stereotypically seen as more emotional or intuitive with this grief, but also that grief can have many different faces or presentations. And it's, you know, the parent who has physically gone through the pregnancy and the loss is often the one that everybody looks at. And there's another parent who has to be a bystander to a lot of this process and this pain, who is, left by the wayside, basically. Yeah. Going to the next slide.
You know, if you also work with dads in that.
Absolutely. So I will see, sometimes I will see the couple together, and from that starting point, I might see them separate as well, to also make sure that the partner who didn't give birth also gets some space for their specific grief. Yeah. So to understand more about this grief, you know, is a little picture up here, which you can see. I think some people might be familiar with the terms in the picture on the left. These are from Kubler-Ross's stages of grief. And, you know, it's difficult to see people trying to capture the complex process of grief in a model, which is why to this date there has not been a model of grief that has been scientifically backed, because, you know, the oversimplification of any type of model just doesn't do any right by what, you know, the reality that we might be going through. Yeah. So at the most, what a model can do is give us a few words to describe, you know, what we might go through at any given day. So our experience might look much more like the picture, the chaotic picture on the right, yeah, where there's nothing linear about it. It's not a nice, tidy process of chapters that we go through with a notion of ever completing this, yeah, because for a lot of people, the loss and the grief is never fully complete. It is more of a, you know, the space it takes in your life will continue to change through your lifetime, but all of these aspects might still be there. Yeah, so maybe what we can acknowledge here is, can we please liberate ourselves from these very cookie cutter societal expectations of what your grief was supposed to look like? Yeah, because this doesn't hold true. And your experience is individual and it is valid. It can be very messy. And, and the people going through it with you, they might, their process might look entirely different at any given day.
Mm-hmm.
Yeah. Going on to the next slide, please. Thank you. So as I already said, grief is such an individual process. So your grief will look different from the people around you. It may also look different from any previous time you may have grieved. It might look different from how maybe your mother grieved a loss of a baby, or your sister, or your friend. Yeah, it's also highly unpredictable. So any given day, and that's part of why it is so difficult to grieve a loss like this. So any given day, we're not quite sure what's up ahead for us that day. We can't rush ourselves through that grief. There are no shortcuts to just get over it. We're kind of forced to just undergo it as it comes and to make space for that. So that's one of the little ways that we can help ourselves, at least, every day, if there's some space where we can decompress and we feel safe. And that varies for people, whether you want a safe, trusted person around, or whether solitude is much more comforting to you. So what a lot of people have a hard time accepting is that, grief doesn't need to be a 24/7 job, and also it can't be. Yeah, it's way too exhausting. But then I have parents telling me, well, I notice on some days that there are moments where I can't think about my baby all the time, or maybe I notice I also try to find some joy, or just, go on with my day. And does that mean I'm a bad mother to this baby, that I'm not grieving properly? But those other moments, they are actually important to help sustain you through this process. Yeah, in grief, there are moments where we may be oriented towards that loss and missing and falling apart and being really bereft. And then there are other moments where we're maybe more oriented towards, finding some structure or support or sustaining ourselves. Yeah, so all those facts, even, distracting yourself for a few moments so that later you have the energy for your grief, are very important during that grief process. Culturally speaking, and also across like different individuals, different genders, the proportions of like when are we turning towards that grief and that emotion versus when are we more busy with the supportive tasks, those proportions will look different for every individual. Yeah, and I would like to introduce that as well, because we also can't judge, yeah, because you already brought up the fathers that might be grieving quite differently, where maybe if he's very busy, for instance, pursuing paperwork with insurance and everything, maybe that's how he supports and honors his grief. Yeah. So when we watch somebody go through their grief, let's not judge what we see in front of us. Yeah. So do notice that it's important for all of you, when you go through grief, or when you notice that your loved ones are going through grief, that sustaining the person who grieves is really important. Yeah, so self-care, looking after yourself physically, also leaning on the other areas of your life that may have not changed at all. Yeah, where some people find it very comforting to go back to the office for a few days and to notice that everything is still in the place where you left it. Yeah, so surrounding yourself with the types of support that can help you get through this. Yeah, and then gradually what people will notice, that even though this will never become easy, or it might still be very uncomfortable, but you gradually do become more attuned to the kind of shifts that you go through during that grief, and it might become at least a little bit easier to roll with all those different punches, so to speak.
Yeah.
Okay, going to the next slide. Yeah, I'd also like to, for those people that are part of the support network, I would like to include some do's and don'ts. And some of these might already, seem obvious, or you may have heard them before. Going over the do's first. Definitely do acknowledge the loss. Yeah, that, don't just skip over it or not mention it. Yeah, so just acknowledging it. You don't even have to say all that much. I'm thinking of you. I'm so sorry for your loss. Don't have to write like long prose or have a long conversation with this person. Just show up and acknowledge what this person has gone through. So if the parents indicate that they welcome this, you can acknowledge the loss and the baby by using the name. Yeah, if the name is known. Yeah. So when parents show that they want to talk to you about it, just try to listen actively. Just being there, taking on board what are the people saying about their experience, what are they feeling. Again, also for sustaining the person who's grieving, to offer practical help and your companionship might go a long way. Yeah, they're not alone. There's somebody to help them get through the time. Offering practical help such as bringing meals, looking after maybe any other children in the family, running errands for them. Definitely do check in regularly. Yeah, over time, I noticed that a lot of parents tell me that after a while, it becomes lonelier. It's like the rest of the world just has kept moving on and they feel like they're left behind. So, certain anniversaries, if it's been like a month or a year, to maybe just sending a message to them saying, hey, I'm thinking of you. Hope you're all right. I'm here for you. Yeah, again, you don't have to, a lot of people worry about what to say, but just keep it simple. Just the simple, I'm thinking of you might be enough. Yeah.
I think this is really important, Linda, that we talk about this, because often that's what I hear from people as well, that it is so hard for us to sit with grief and with tears and the sadness and so on. And we are worried about saying the wrong thing and the straw, and we don't want to, we don't engage when every mom having gone through loss wants us to, acknowledge it and to be there for them, even if it's just to sit next to them or, as you say, run errands and do practical things. And
exactly.
Why has death become so taboo? But it is a very uncomfortable thing for most people.
Yeah, and it gets people so stuck in that isolation and feeling like, their life has come to a screeching halt. Yeah. So less is more there as well. Just your presence, just maybe repeating, I'm here, I am listening, I'm so sorry for that. Yeah. So keep it really simple. You don't have to come up with some brilliant words or anything. Just keep it really simple. Yeah. Something that I tell to parents that are grieving, as well as to people who try to support them, is maybe to just check in with yourself. What is going on? What might you need? And people that support parents, they could just ask for instructions. Yeah. Rather than just assuming what might be helpful, maybe just asking, is there anything today that I'm able to do for you? Yeah. This will once again depend, where is this parent at today? Some days maybe she just wants a shoulder to cry on. Others maybe more like, I don't want to think about it at all. I need some distraction today. Can you tell me about your recent vacation? Yeah. So basically, if you don't know what to do, maybe just ask. Yeah. Is there anything that I can do for you right now? How may I help? Yeah. Moving over to the don'ts. Again, for that isolation, and what you definitely shouldn't do is withdraw from those parents or avoid them. Yeah. I know it feels awkward sometimes, but it's also very awkward for the parents sitting there all by themselves, and all of a sudden the silence is absolutely deafening.
Yeah.
If nobody dares to approach you. Yeah. So don't do that. Even if you feel like, maybe it's been a week and you found it really hard to think about them, and now you feel guilty that you haven't checked in. Pick up the phone, then send a little message. Yeah. Just breaking that silence and reaching out, letting them know that you're there. also do not place any expectations as to, oh, you should have been over this by now. Why can't you just move on? And yeah, so we can't tell for another person how long this is going to take or what is reasonable. Yeah, you don't know that. Yeah, so the next point, do not minimize the grief by certain comments. And I know that people say a lot of things and they mean very well, but it is such a blow when you hear things like, well, at least, you're young, you can try again, or at least now you know that you can get pregnant. Yeah, so these don't diminish what the person has just gone through and that they lost a baby. Yeah,
Yeah.
so you don't have to come up with some brilliant remarks or anything. Yeah, none of these comments are necessary. Also, please refrain from making this about your own stories and experience. Yeah, letting the person who's grieving be in the center and be supportive. And at times, the parents might indicate that it might be helpful. Yeah, for instance, if you say, "Oh yeah, I went through a loss as well," so that maybe that's maybe all they need to know, so that they realize, "Hey, I'm not alone. This didn't just happen to me." But to not steal the spotlight, or yeah, because the person's already grieving. If they then also have to carry your story in that moment, that's a bit much. Yeah. Okay. Next slide. Thank you. So pregnancies following after a loss. I realize that for so many parents that, a loss may be, an experience they have during their journey of adding a baby to the family. And that this is, for a lot of parents, not the end of that journey, and they are still hoping for another baby. And that might make the situation a bit complicated in terms of trying to conceive, going through a fertility journey, but also the experience that they may have during a subsequent pregnancy. Yeah, what I hear from a lot of moms is that they feel rushed to get through their grief because they somehow have the notion, I need to complete this grief, otherwise I don't get to start another pregnancy. Yeah, and there's this that myth of having to be over it, because this is a type of loss. Maybe we'll never be fully over it. Yeah, so then should we just wait forever, or we can't be pregnant again? So at the very least, maybe examine with yourself, like, have I moved on sufficiently such that I can be grieving, and I can also be trying to conceive. I can also be pregnant again. Yeah. As part of trying to conceive again, your body has gone through this whole experience with you, and our bodies grieve with us. Yeah, we hold the grief as well. So we may slowly have to befriend our body again, learn to be gentle and tune into what it wants, reclaiming the intimacy as well, because that grief that is held within a couple is also very difficult. But to just be very patient with yourself and each other, but still at your own pace, finding some way to physically and emotionally move closer to each other again. No pressure. Yeah. Separating the stories of this pregnancy versus the pregnancy where I had the loss, that's a very difficult one for a lot of parents. And there as well, a lot of parents tell me about how they feel they are robbed of the ability to just be naive and joyfully expecting. Yeah, it's like, all of a sudden they have to worry about things. They are faced with a reality that, it's not just simply joyful expectation. Yeah, so we do need enough space that we can separate the stories out, not just making enough space for this pregnancy to be different, but also making space to still grieve and honor the baby that we lost. Yeah. And there, while taking it one day at a time, doing the very best once again to sustain yourself with your grief and with your pregnancy or with your fertility journey. The same can be applied to when once again you're back on that whole process of going through month after month of trying or medical appointments. Can we take each cycle as its own event? And each time, and there might be disappointments again where this month it didn't work. Can we then make decisions for next month? Okay, next month, these are some things I want for myself. Here are ways I'm going to take care of myself and help myself get through the time. Yeah.
Mhm.
You can make subtle changes. And there's even, it can be powerful even. Some parents talk to me about it, letting this be a new chapter. Sometimes they even change to a different hospital or a different doctor just so that they have control over that environment, the backdrop of the whole story.
Yeah, absolutely. And I think subsequent pregnancies are always a time where we are anxious, we're fearful.
Yes.
We
Yeah.
are might believe that we have moved on and have been given that gift of being.
Yeah.
But at the same time, there's so much anxiety where we sort of we don't know. And this is my own experience as well, where
Yeah.
if I could connect to this new pregnancy. And it almost was like I wanted to ignore it until the baby was,
Exactly. Yeah.
you know what I mean? So that can be
It's
quite.
actually really important that you mention that because that is true. Our hearts will take it really slow sometimes with connecting with this pregnancy, bonding with the baby. Just understand that maybe even out of love for this new baby and the one that we lost, that our heart wants to take this extra slow, and we can honor our heart for doing it that way. Yeah. And but the guilt can be enormous, like why don't I feel love yet or a connection for this baby? But you are doing the hard work of just being pregnant one day at a time, or just trying to conceive one day at a time. Yeah. And to
Absolutely.
go easy with yourself there as well. Yeah.
I wanted to read a comment that we had in the chat. I heard others who thought they meant well, saying, "You're still young, it's okay, stay strong." But I just went through a traumatic experience, and those statements did not apply in any meaningful way. 7 months on, I'm better at managing and reacting to hearing that from people.
Mm-hmm. Yeah. Yeah, that is so common. And I'm sorry that you had to go through that as well. Yeah, it's sometimes I hear people say that, in trying to manage those comments that might come, that, you kind of it's almost like you have to put on some kind of like biohazard suit when you go out there, like, oh, help, what might come in today? What stupid remark might I hear? Yeah. So
That's a very
I'm
good.
seeing all the parents that are valiantly just trying to get through their day and try not to be so hurt. Yeah.
I like how you said biohazard
Yeah.
facade. that really, is how I felt during the initial months, and
Yes.
it was awful.
Yeah. And you've had to be so brave, and but people don't understand how much energy that takes. Yeah, to have to be so brave and to have to face that. Okay, moving on. So we cannot talk about loss without also addressing, anxiety and trauma, because this comes up so much, as we've already discussed. So when we experience something that is really, really awful or intensely difficult, or especially this is a life and death moment that we have gone through. So this throws us into that very acute survival mode. Yeah. It also means that the way that we hold on to the experience just comes wrapped up in that survival mode, and that during the grief and all the flashbacks of it and the anxiety in a subsequent pregnancy, for instance, that that fire alarm is so easily triggered again and again and again. Yeah, that's sadly that is also the function of our brain. Yeah, we are given brains because our brains help us to survive, but brains are not designed to make it look pretty or feel nice. Yeah, the number one task is we need to survive, our babies need to survive. Yeah, but this is exhausting and it's really, really overwhelming. Yeah, so some common themes, it's not just a horrible thing we went through, but it's often like the themes or the beliefs about ourselves or our lives that stick with us, such as, things like pregnancy is dangerous. Yeah, maybe that's the belief that becomes really sticky. That sense that I am powerless, I'm helpless, there's nothing I can do. I'm all alone, this is all on me, there's nobody to help me. But also what you see a lot with pregnancy loss and infant loss is that, you know, somehow your brain assigns some type of responsibility or self-blame to you. Yeah, even almost to the point where we rationally know this could never have been our fault. And yet our brain wants to go there. Yeah, if only we could control this, then maybe we could get ourselves out of the danger. But look, now I failed to control this. Yeah, so this is a really tricky spot that a lot of our brains could get stuck in. Yeah. So trauma symptoms that you might encounter after a loss are maybe flashbacks, very intense emotions that just flood over you. It's almost like, you know, your brain just like freezes up and goes offline. Yeah, you can't make sense of anything. You're just awash with those emotions. Sometimes even numbness and detachment. It's just trying to survive this. We are in the trenches still and again. It's almost like we're flung back to that very dangerous moment. And common as well as avoidance. Yeah, we want to avoid looking at women who are pregnant. We get almost like a panic attack when our taxi drives past the hospital where it happens. Yeah. So if you notice any of these things, or if your loved one is going through these kind of things, so when you're experiencing trauma, that is definitely a reason to look out for professional help. Yeah. We can help your brain to process this. Yeah. Even more common than trauma is the anxiety, and that is just, you know, it's ubiquitous with any next pregnancy or experiences after. And this is also, you know, we can't tell a parent who's gone through a loss, just don't worry, yeah? Because this is a parent who has seen the horrible what ifs come true, yeah? So you can't convince that person's brain that, yeah, you know, you've got nothing to worry about. Yeah, so we will need to find ways to cope with the anxiety while also maybe just honoring that anxiety is just trying to show up to help us to survive or to help a next baby to hopefully survive. Yeah, and the anxiety can take on so many different faces. Like, you know, you might worry and ruminate a lot. You might be hypervigilant. Yeah, and notice, for instance, moms that say they've gone through a loss and they have an older child already, and all of a sudden they're a lot more worried about their child. Yeah. Perfectionism, so I need to control everything to the max, and only perfect is good enough. So that they're relentless with themselves sometimes, setting these impossible standards. Yeah, panic attacks also very common, like it just your system once again freezing up by what it's facing. Yeah.
I'm going to talk at a later stage about how you work with trauma and how that exactly looks like.
Yes, actually, I can tell a little bit about that now. There are different ways in which therapists can help a person to process their trauma. Please note as well, like, you know, if any therapist just has you talk about and relive your trauma and doesn't offer any kind of tools to help your brain to process it, then basically you're just being wounded and hurt again. Yeah. So please don't feel you just have to talk and talk and talk about it, or feel forced to go into painful details to rehash it, because that's also, I think, why a lot of people might shy away from seeking counseling. Like, I can't face talking about it. Yeah. A well-informed counselor should actually know that, you know, we should check with you whether you even want to talk about certain details, and you get to decide which things you want to bring up. Yeah. And only if and when you want to address and process the trauma, that is when, you know, we will very gradually and controlled and supported by tools, we'll start bringing out parts of that experience or those sticky beliefs and thoughts that are in your brain. Yeah, there are different therapy modalities to deal with it. The one that myself and my colleagues utilize very often, which is evidence-based to be a very, very effective therapy for trauma and PTSD, is EMDR. It stands for eye movement desensitization and reprocessing therapy. This is a way where we can make a very controlled space for your brain to go through the memories a lot more slowly, because actually our brains would be capable of processing and filing away all the aspects of the experience. It's just that every time your brain and your attention goes close to this festering heap with all the alarm bells and whistles, yeah, your brain just keeps getting choked up. Yeah, so EMDR is just a way to do that with a lot of hand holding and just downloading it much slower so that your brain itself can make the decisions how to move with this experience and how to move to a different place with it. Yeah, so it's not hocus pocus. It's also not hypnosis. Yeah, but we can see our clients' brains doing some really amazing things in just making more sense of it and attaching themselves back to their tools and their strengths and their skills and their support. Yeah. Aside from that, there are also other ways to rebuild safety, because I think the main task we have when we look at trauma is that we help your brain and your nervous system to restore that sense of safety. Yeah, if we can build that safety again for ourselves, and then we can move. Yeah. So even if there's few clients who tell me that EMDR just sounds a bit too overwhelming to them. And okay, so we've got other tools. Yeah, there are other ways to rebuild that safety. Yeah. Yeah, in therapy, we're not going into your story unless there are tools for you to build that safety with every little step that we delve into your experience.
Yeah, amazing. That's really good to hear. And it's good for moms to know that there are different options out there, because not everybody, as you say, is comfortable necessarily talking over and over again, and reliving basically. But so
exactly. And that is up to you, and it should be up to you. If you encounter a counselor who wants to just, even though you don't want to, wants to just pull you into your experiences, asking really painful questions, that's maybe not the counselor for you. Yeah, absolutely. You lead the way. You lead the way. Yeah. So here's just an overview of when to seek help, and also for those people that are supporting somebody grieving, maybe some indications to look out for. So grief is a process. It can be very overwhelming at times, but at least it seems like maybe the landscape starts changing here and there, or every day looks different. But if you feel that you're stuck somehow, like I've gone in the same loop for quite a long time and I feel stuck with it, yeah, that's something where counseling, having that supportive space and somebody who receives your story with some tools there for you to utilize, yeah, can help you to keep moving with the process. Yeah. Also, what we see quite a lot is that grief can cause a strain on your relationship. Yeah. So even though I personally don't do marriage counseling per se, but for couples that are grieving pregnancy or infant loss, I will see you together. We can also then look out, because some of my colleagues in the wider team of Alliance Counseling, they do provide marriage counseling. There's a need for that as well. Then, we can make this a team approach. But yeah, just allowing yourself that space where you can learn to communicate and also do things for yourself, so that you don't have to lean too heavily on each other. Yeah. Realizing that when couples go through this, sometimes that's the only other person who knows about your grief, but at the same time, that person is equally hurt. Yeah, so that's placing a lot of a load on somebody that you love.
Yeah? Equally, and also realizing that every individual goes at it at a different pace.
Exactly. Yeah.
Not grieving, it's just that their approach is a different one, or they're at a different stage in their process.
Yeah, there's something I see quite often is resentment towards the partner who is living their grief so differently. Like, does that mean he doesn't care about our baby?
Yeah.
Yeah. So we may make assumptions in our grief that my partner is not grieving equally, or my partner didn't love the baby, or my partner is not taking my pain seriously. So to have partners be able to express that to each other and to understand each other's grief process better, and then you notice that they instantly feel less alone.
Mm-hmm.
Yeah. So yeah. So moving on with this list, difficulty coping. Yeah, especially after a while, you just find it too hard to participate in your daily life, and you feel so blocked. And You know, are there ways that maybe we can help to make that a bit more manageable, feeling more safely? Yeah. If you have any existing mental health conditions, those could worsen. For instance, if you already have a lot of anxiety, or if you have a clinical depression, then this could, you know, it's almost like a strain injury for your brain. And then we put another injury of grief on top of that, that could become a lot to bear. Yeah, so if that's the case, just be extra gentle with yourself and ask for help if you need it. Yeah, as mentioned before, anxiety or trauma, which we've gone over. Also, because I do know that, you know, if you still have that goal to continue your fertility journey or want to be pregnant again, but you feel that your grief is holding you back and you're not able to fulfill those dreams that you still hold, those hopes, yeah, then we can talk about that as well, like how to allot space to all these things that matter to you, including your grief and including your fertility journey. Yeah. So moving on. So I talked a little bit about trauma counseling and grief counseling already. Please note there are multiple counselors in Singapore that could help you with this. And that, you know, every counselor is different, and it's, you know, the click between you and the therapist is really important. Yeah. That relationship that you start building with a counselor, that has to bear a lot of that load. So find somebody that you feel happy and comfortable with, that you feel safe with. In the case of pregnancy and infant loss and the resulting anxiety and trauma, it's very important that you go to a therapist that is well versed in that domain, yeah, who knows about perinatal mental health, who is trained and experienced in grief counseling, who has had training and experience as well in trauma therapy. Yeah, there are clients that come to me that, you know, maybe they have a counselor that helped them with their burnout at work, for instance, and they try to broach the subject of their miscarriage, but find that while this therapist has wonderful tools for their burnout and their career path, that maybe, you know, that grief aspect and that trauma doesn't find a home with their usual therapist. Yeah. Also doesn't mean you have to fire that therapist, just keep that one for that other journey. Yeah. It's also okay for sometimes, you know, you see more therapists at the same time, and each has their own domain of what you want out of them. And that's absolutely fine and common. You would want to look for somebody that shows you that they have compassion and that they don't hold judgment for the journey that you're going through. And also not somebody who makes it about fixing your grief or like cramming you into some formulaic therapy approach. What I personally notice, and my colleagues who do grief counseling as well, is that, you know, grief counseling is possibly the least formulaic therapy. Yeah, your grief is so individual that I'm not going to, like, you know, stick you into some kind of formulaic method. Yeah, I'm trying to follow you and make space for you as best as I can. So counseling could also help you with your understanding. Yeah, so giving words and understanding to that, you know, what's going on in my grief, what might my partner be going through. Sometimes just that bit of education about what am I even looking at. Yeah, so you don't have to try to guess what the hell is going on or jump to conclusions. Yeah, so able to help you process anxiety and trauma. And once again, yeah, not making you recount or relive your trauma just for the heck of talking about it, because just some catharsis and crying over your story is not going to do the job for you.
Mm-hmm. Yeah, really important.
Yeah. Okay, so here are just on the screen right now some details on where to find me and my team if you want to reach out for questions or support. Yeah. And
that's amazing.
Yeah, thank you.
Paste that, and we'll have it under our video as well. I just wanted to quickly, as I promised, talk a little bit about what other modalities could potentially help. And we do have, I think the first step is always, for me personally, counseling. That's where I would send my clients, because I think that is the basis of everything that you're going to do before moving on to maybe other modalities or maybe even alongside. So I really encourage you to go back on our YouTube channel, where I posted last year's coffee mornings that we had with different modalities, so you can get a feel for the modality itself and for the individual therapist. Like Linda was saying, it's very individual who you connect with and who you feel comfortable sharing with as well. We have great physical modalities that we talked about with Sarah Bales. She's a lost mama herself. She is so beautiful and gentle at doing osteopathy and craniosacral therapy. You could consider chiropractic, which I often refer to Dr. Daniel, Dr. Shondell, and Janelle, and I will definitely, and to Eamon as well. So I will post their details. So for me, chiropractic addresses the central nervous system a lot. So that can help a lot with relieving anxiety and stress and trauma as well in a more physical kind of way. We had an introduction to traditional Chinese medicine, which with acupuncture can also do a great job. So I'll post some contacts for that. And then we had introduced energy work with Reiki and Body Talk, for which we have great practitioners here in Singapore as well. So sharing that. And then I wanted to say, for anyone who's listening now, and whether you want to share that with friends that are having a difficult time going through loss, we have a Bumpwise group, a WhatsApp group that is dedicated to lost mamas. So I say mamas because we actually keep except for the daddies group, we keep our groups only for females. And the reason is that they need to feel comfortable and safe in sharing. So the daddies have their own group and we have the mamas in a different group. And for this year, going forward, we are going to be organizing a few events. One is a great restorative yoga session that will happen at the end of the month at Kindle Studio with the wonderful Lisa, who again is a lost mama herself, a termination mama herself. And so we'll do that. And then there'll be an art therapy kind of session where you can explore yet another modality. I don't know if art is your thing, but for some people it is. Sometimes talking is not what you need in the moment, but we are also organizing, and I think it's you, Chris, that I was speaking to about this. I hope that it's the right person. We're going to organize just to walk alongside each other and know that we're not alone.
Yes, that's me.
Amazing, Chris. It's so nice that you've instigated this initiative, because like we said when we talked, is basically not everybody is ready to share and join a sharing circle and do group therapy kind of thing. But it's always good to know we're not alone, and we're walking together, commemorating these mamas and these babies that we've lost, and we really want to give them a name and show up for each other, basically.
Yeah. Oh, I know I owe you a date, and I'm coming back to you on that.
There's absolutely no rush. I know we all have a lot on our plates, but I'm looking forward to doing that together.
Me too. Thank you.
I'm so happy that we did the session today. Last year's recording, unfortunately, isn't available anymore. So I wanted to do this again and really show how we can support these mamas. As I said at the beginning, it is very much us as a community that needs to do better by these parents and couples who are going through this. So I hope we got some really useful information so that we can be a better support. And thank you, Linda, for sharing your knowledge and expertise with this as well. I found it really really informative to learn about different ways that even a counselor or a therapist can approach this topic, and that there are indeed different modalities available to them, and that there's a difference between different types of counseling as well. So that was really useful, and I thank you for spending your morning with us. And I'll send you the link for the video afterwards as well, so that you can share if there is a need for it as well.
Yeah, thank you, Johanna, for having me. It's always a pleasure to support parents as a team.
Amazing. Thank you so much, Linda, and thank you for all the mamas who joined. And I hope I'll see you soon at one of our events as well. Goodbye.